Hi, so now we will review the historical perspectives, goals, categories of social welfare so that you'll understand how society responds to people's needs. So, this is only a review since you are expected to be familiar by now as to the history of social welfare in the Philippines. So, social welfare is an established response to varied human needs and problems requiring a vast and organized system of services. So, I highlighted the term established because the very purpose why we are studying social welfare is that we want to make it systematic so that it can really address the issues and, of course, the needs of the people. In relation to needs, the theory of Maslow's hierarchy of needs is still being used. Intrinsically, it is talking about the motivation of people towards achieving that so called self actualization. So, Maslow used the terms physiological, safety, belonging and love, social needs or esteem, and self actualization to describe the pattern through which human behavior or human motivations generally move. So these are also among the platform we are using in terms of creating needs-based interventions. This means that in order for motivation to arise at the next stage, each stage must be satisfied within the individual themselves. And this theory is a main base in knowing how effort and motivation are correlated when discussing human behavior. But we do not say that there is a need to fully satisfy one level before you can proceed to the next because in reality all of these needs should come in together, so in the purpose of ensuring holistic growth. So the context of addressing the needs include, of course, the basic needs. And most programs, if the resources are limited, are focusing only to addressing the basic needs. But we understand that we need more than that. That's why this framework would also serve as one of our theoretical basis in terms of pushing for higher level interventions and developmental activities so that we can help people become what they can possibly be. So each of these individual levels contain a certain amount of internal sensation that must be met in order for an individual to complete it. So the goal, as I've mentioned, is to achieve self-actualization. So the self-actualization will also allow the person to contribute more to the community. So talking about the history of social welfare, we begin to say that even prior to the coming of any colonizer, so during the prehistoric period, the communities are already coming together for mutual protection and economic survival. So, for instance, the barangay as ruled by the dato and how the groups would band together and communities would link with each other through marriage among members. In the Spanish times, among the problems that existed were the creation of pueblos, in which the people were gathered or concentrated in a small space. And such concentration of people had led to health and sanitation problems, personal maladjustments, economic dislocation, establishments of hospitals, asylums, orphanage, and schools for the boys. So before the, as you have learned in your result class, how the preference for boys are given in terms of education before. The motive for religious for the salvation of the souls, which was the underlying philosophy of social welfare activities. So most people would help because they want to save their souls. So the Christianity had been introduced in this context in relation to social welfare. And we know that the outbreak of the revolution had also caused a lot of separation in the family and other problems in the community, not to mention the human rights violations as well. So during the American period, we had new educational system, new health methods, the concept of religious freedom was introduced, and on February 5, 1915, the American government created the Public Welfare Board with the passage of the Legislative Act 2510, and such had cost for the government to essentially coordinate with the welfare activities with the already existing charitable institutions. In 1917, the Associated Charities of Manila was founded. The If you can still remember your history of social welfare in the world context, there is the concept of community chest, and it was the same model that they used in the Associated Charities of Manila. So the idea was to centralize the receipt and distribution of donations to different charitable institutions. In 1924, the Associated Charities had become an independent agency, but that time it was under the supervision of Public Welfare Commissioner, which was partly financed by the government and the private contribution. So as early as this stage, the need for the government and the private sector to work together had already been manifested. We also have the so-called social health centers, which combined health and social services. In 1930, there were economic depression, and in the administration of Murphy, social welfare program was integrated in the programs of the government. And it marked the first time in which the government as well assumed full responsibility for the relief of the distress due to any cause. And among the leaders in social work that time was Dr. Jose Fabella, who was known as the father of public health and social welfare in the Philippines. During the Commonwealth period, we had the rural charity clinic. So there had been a call to give focus not just in the situation of the urban areas, but also in the rural areas. And there were also home for mentally challenged children and for the aged and infirm in Welfareville. Welfareville is actually in Mandaluyong. We also have the anti-usury laws to ensure the limit of the interest when people would lend money. The 8-hour labor law was introduced, the minimum wage law. The government also had housing projects and the creation of the relief boards for natural calamities, economic crisis, and unemployment came into existence. The Public Assistance Service took over in 1941 because of issues in terms of political situation in the country. Then the Japanese occupation came in, and we know how the Second World War brought death and immeasurable suffering to the country's population. Although um, the Japanese occupation only lasted for 3 years, but the terrors experienced by Filipinos before, where beyond imagination. So we hear of tragic stories, especially of violence and injustice. And the social welfare activities that time consisted mainly of giving medical care and treatment because there's conflict in most areas in the country. So the political situation is also very not stable. And aside from that, other social welfare activities included giving of food, clothing, not just to the soldiers, but even to the prisoners, and of course, the civilians. And that time, the churches and convents were also used as centers of operations to respond to the need to help those who are victims of war. Then came the post war years, in which the Social Welfare Commission already had offered three categories of services, which are the child welfare work, public assistance in the form of relief and casework services to indigent war victims and physically handicapped and infirm, or those who are elderly. And the other category is the coordination and supervision of all public welfare activities. The War Relief Office was placed under the control of the Social Welfare Commission, providing additional sources of funds and allowing the Commission to have provincial branches which carried out outright relief, family and child welfare, and rehabilitation services. Then we also had the welfare home for women and girls, the call for equality had already started to become more popularized, and although the level of acceptance was not that easy, coming from the long um, religious roots and perspectives of the Philippine society in general. The upsurge of socioeconomic and political problems also resulted to a lot of difficult circumstances like more poverty and rural unrest. So the level of trust of the people as to the ability of the government to respond to their needs and to improve social welfare activities had also created a lot of difficulties as to public welfare administration. And to respond to that, in August 1948, President Quirino created the Presidential Action Committee on Social Amelioration, or PACSA, which was charged with the duty of giving relief assistance to the hungry, homeless, and sick, and to those who are victims of violence. And it does not only included response program, but it also had health, education, welfare, agricultural, public works, and financing. So although there are already a lot of programs introduced, that time we cannot really say that there is already that established system. So they try to respond to every important aspects, but it's not that organized yet. So on January 3, 1951, the Social Welfare Commission and the PACSA were fused into one agency. And such agency was called the Social Welfare Administration. And the office had two programs. First is assistance and then service. So the assistance included provision of material aid like food, financial aid, transportation, medical, institutional care, and work relief. While the service included rehabilitation services, the provision of educational, health, and medical facilities, and